Hi friends, welcome to FastCoder 21 Medical Coding YouTube channel. In the channel, we are going to get all the latest updates in the medical coding field, including APC updates, AHIMA updates, and CMS updates, along with interview questions and answers of inpatient, HCC, same-day surgery, denial management, and anesthesia medical coding. If you are visiting for the first time, click on subscribe button to receive future updates. In this session, we are going to learn current procedural terminology CPT 2023 updates. If anyone working in the same day surgery or ambulatory surgery coding, we know the CPT updates in order to code properly. In order to gain in-depth knowledge, please watch this video until the end to know complete updates. So today's session we are going to learn mostly related to the surgery coding system like integumentary system, musculoskeletal system, respiratory system, cardiovascular system, digestive system, urinary system, male genital system, nervous system, eye and ocular adnexa, and auditory system. So here we have created CPT changes by the chapter wise. So first column is additions, second column is revisions, and third column is deletions. For example, if you take integumentary system, we have three additions, one revision and one deletion. If you take musculoskeletal system, we have one addition, two revisions, and there are no deletions here. And respiratory system, we have only one addition. Cardiovascular system, we have seven additions, one revision, and there are no deletions here. Digest system, we have 17 editions and there are no revisions here and deletions are 18. If you take urinary system, we have one edition and one revision. In male genital system, we have one edition and there are no revision or there are no deletions. And there are no addition in nervous system and we have seven revisions in nervous system and there are no deletions. And eye and ocular adnexa, we don't have any additions. We have only two revisions. And auditory system, we have three additions, five revisions, and there are no deletions. So we are going to learn all these surgery systems step by step in the following session. If you would like to know evaluation management and radiology, pathology and laboratory, medicine, category 3 and administrative, multi-analyte essays with algorithmic analysis, please mention in the comment section. We will make one separate session for remaining all the updates. So overall in 2023, we have 224 CPT code editions and 93 code revisions and 74 deletions. Along with these updates, we are also using CPT edition. So first we are going to learn about integumentary system updates. So in order to understand easily, we have marked all the deletions in red color, all the revisions in blue color, and all the additions in green color in all the chapters. So in integumentary, first code is deleted, which is 15850, which is removal of sutures under anesthesia other than local, same surgeon. So you can't see 15850 in 2023. So 15851 code description is revised here. Old description of 15851 is removal of sutures under anesthesia other than local other surgeon. But from 2023 onward, but there is a revised description for 15851 which is removal of sutures or staples requiring anesthesia, that is general anesthesia and moderate sedation, which is included in 2023. In integumentary, we have three codes added. First one is 15778, 15853, 15854. 15853 and 15854 are add-on codes. So if you check the description of 15778 for implantation of absorbable mesh or other processes for delayed closure of defects, that is external genitalia, perineum, abdominal wall due to soft tissue infection or trauma. So whenever there is a trauma on the external genitalia, perineum and abdominal wall, we need to use 15778 implantation of absorbable mesh or other processes for delayed closure of defects. So here we have two add-on codes, 15853 for removal of sutures or staples not requiring anesthesia. This code we need to list separately in addition to the E&M code. And also we have one more code here, 15854 for removal of sutures and staples not requiring anesthesia. This code also we need to list separately in addition to E&M code. So if you observe the difference here, 15853 is for removal of sutures or staples. So 15854 is for removal of sutures and staples. So in 15853 we can code this code for removal of sutures or staple. Anyone is enough without anesthesia. But in order to code 15854, physician has to remove sutures and staples without using anesthesia. So we have one more guideline added here. 15853 and 15854 code should not be separately reported during a 10 or 90-day global surgical period. One means suture removal and staples removal is included in the global period. So we can't code these two codes along with 10-day or 90-day global period procedures. Next chapter, musculoskeletal system updates. Here we have one code deleted. Total disc arthroplasty code moves from category 3 to category 1 status. So previously total disc arthroplasty code is included in the temporary codes and now it is converted to category 1 status. So code 0163T total disc arthroplasty anterior approach including discectomy to prepare interspace. Each additional interspace lumbar has been deleted for 2023. So this is, as you know, category 3 codes are temporary codes. So here 0163T code is deleted in 2023. So in its place, the AMA divides a new add-on code 228602 report for anterior implant of total disc arthroplasty at a second level only. For the third and other levels, we need to code unlisted code 22899. So in order to code initial total disc arthroplasty code, we need to use 22857 is revised to be a parent code. So here 22857 is parent code and 22860 is for the arthroplasty second level only, and remaining third or other levels we need to use unlisted code which is 22899. So here first level 22857, second level 22860, third and all other levels we need to code 22899. So in musculoskeletal we have added one code which is we already learned, which is code 22860 to report for anterior implant of total disc arthroplasty. It is second level only. So we need to use 22860 for only second level, not for first level, even third or other levels. So for third and all other levels, we need to report the unlisted code 22899. For the first code, like primary code, we need to use 22857 for single level or first level. So as we learned just now, 22857 is for first level. Initial total disc arthroplasty is reverted to be a parent code. So 22857 is parent code now. So total disc arthroplasty anterior approach including discectomy to prepare interspace other than for decompression single interspace lumbar. So we have one more update for sacroiliac joint fusion code. So code 27279 describes percutaneous arthrodesis of the sacroiliac joint using minimally invasive technique to place an internal fixation device that passes through the ilium across the sacroiliac joint and into the sacrum, thus transfixing the sacroiliac joint. And our guideline is report 0775T for the percutaneous placement of an intra-articular stabilization device into the sacroiliac joint using minimally invasive technique that does not transfix the sacroiliac joint. For percutaneous arthrodesis of sacroiliac joint utilizing both a transfixation device and intra-articular implant, we need to use 27299. So if we check 27279 and 27299, 27279 is for percutaneous arthrodesis of the sacroiliac joint using a minimally invasive technique. So if you take this 27299, so here percutaneous arthrodesis of the sacroiliac joint utilizing both a transfixation device and intra-articular implant. If the physician performed sacroiliac joint arthrodesis using transfixation device and intra-articular implant, we need to use 27299. If the physician uses only internal fixation, we need to use 27279. So now we are going to learn about 27280. So if we check 27280 in 2022, which is arthrodesis open sacroiliac joint, including obtaining bone graft, including instrumentation when performed. But in 2023, 27280 arthrodesis sacroiliac joint open, including here they have released includes obtaining bone graft and instrumentation when performed. So basically in 27280, MA has deleted including word here and they have mentioned includes. So here only code description is changed. Instead of including, they have used includes. And also here we can't use or report 27280 in conjunction with 0775T, which is percutaneous placement of an intra-articular stabilization device into the sacroiliac joint using minimally invasive technique. So, and also we have one more guideline for percutaneous minimally invasive arthrodesis of the sacroiliac joint without fracture and or dislocation utilizing a transfixation device. We need to use 27279. So in respiratory system, we don't have much updates. So they have added only one code here, which is 30469, repair of nasal valve collapse with low energy temperature control like radio frequency, subcutaneous and submucosal remodeling. So there is only one addition. There are no revisions or there are no deletions in respiratory system. Now we will check cardiovascular system updates. So in cardiovascular system, we have few changes like few codes added. So which are the added codes are 33900 to 33904, which describes percutaneous pulmonary artery revascularization by stent replacement. So which is a new code utilizing in 2023. And also we have 36836 and 36837. Only difference is 36836 we have single access and 36837 we have separate access sites for peripheral artery. In cardiovascular system we have one code revised which is 35883, which is as a revision to the example listed within the long descriptor. So in 2023, we have most of the updates in digestive system. So in digestive system also, hernia codes, they have changed completely. They have removed 17 codes, 18 codes, and they have added 17 new codes. So we are going to learn added codes first. 43290, esophagogastroduodenoscopy, flexible transforal with deployment of intragastric bariatric balloon. So which is a new code. So next one 43291, esophagogastroduodenoscopy, flexible transforal with removal of intragastric bariatric balloon. So 90 is for insertion and 91 is for removal. Like deployment, insertion, both are same only. So deployment of intragastric bariatric balloon, we will use 90. So for in order to remove that, we will use 43291. So we have most of the codes deleted in hernia repair section. If you see here 49560, 61, 65, 66, 68, like 70, 72, 80, 82, 85, 87, 90. All these codes are deleted. So in the place of these codes, they have added other new codes. So in hernia repair codes in this section are categorized primarily by the type of hernia. For example, inguinal, femoral, lumbar, omphalocele, anterior abdominal or parastomal. So now we will learn added new hernia codes. For example, if you take 49591, repair of anterior abdominal wall hernia, that is epigastric, incisional, ventral, umbilical, spigelian, any approach, open, laparoscopic or robotic, initial, including implantation of mesh or other processes when performed, total length of defect less than 3 centimeters, reducible. So previously we have three separate sections for open and laparoscopic, but in 2023 they have added. So if you see here, so if you see in 2023, 22, we have 49560, which is open procedure. We have one separate section for separate code for open procedure, as well as if you come down, we have separate section for laparoscopic repair here. So laparoscopic hernia repair. But in 2023, we are going to use same code for both open as well as laparoscopic. And one more thing we need to here identify the requirement to code hernia repair in 2023 is defect size. So for example here, if it is defect is less than 3 centimeters, we need to code 49591. So less than, and also we need to check reducible or incarcerated or strangulated. So if it is reducible less than 3 centimeters, we need to use 49591. So less than 3 incarcerated, we need to use 49592. So if it is 3 to 10 centimeters reducible, we need to use 49593. So if it is 3 centimeters to 10 centimeters incarcerated or strangulated, 49594. So greater than 10 centimeter reducible, 49595, and greater than 10 centimeters incarcerated or strangulated, we need to use 49596. So here you need to understand we have only one difference here. 49591 series is for initial hernia and 49613 series is for recurrent hernia. So in order to code initials, we need to add 49591. For the recurrent hernias, we need to use 49613 series like 13, 14, 15, 16, 17, 18. So 49621 is for repair of parastromal hernia, any approach, open, laparoscopic, robotic, initial or recurrent, including implantation of mesh or other processes when performed reducible. So 49622 incarcerated or strangulated. So 49623 is the add-on code, which is removal of total or near total non-infected mesh or other processes at the time of initial or recurrent anterior abdominal hernia repair or parastromal hernia repair, any approach. So basically what happens here, so in order to code hernia repairs in 2023, we need to check first what is the type of hernia, whether it is epigastric, incisional, ventral, inguinal or any type of hernia, and whether it is initial or recurrent, and we need to see check and what is the defect size and whether it is reducible or incarcerated. So in urinary system updates, we have only revisions. So in urinary system, we have codes for percutaneous nephrolithotomy or pyelolithotomy 480 and 50,081 are revised to clarify which services are included when performing the procedure. So they can be properly valued. For example, if you take 50,080 is reported for simple procedure that involves stones up to 2 centimeters. So stones greater than 2 centimeters, branching stones, stones in multiple location, ureteral stones, and anatomical complications are considered complex and reported with 50,081 series codes. So in male genital system, we have only one addition of code, which is 55867, laparoscopic simple subtotal prostatectomy. This procedure includes robotic assistance when performed. So In prostatectomy, we no need to code robotic assistance separately, which is included in 55867 in 2023. So in nervous system, we have few updates here. Only code revision in 2022. We need to code imaging guidance separately along with 6445152, 64417 and 64445 64448. So if you check here, imaging guidance and localization may be reported separately for 64400 to 64450 in 2022. So from 2023, we no need to code imaging guidance separately along with these three subcodes, imaging guidance included in the code description. In eye and ocular readiness updates, we have only revisions. For example, here transluminal dilation of aqueous outflow canal codes 66174 and 66175 are revised to include canaloplasty as an example. So if you check in 2022, you don't have the word canaloplasty for 66174, transluminal dilation of aqueous outflow canal without retention of device or stent. But if you check in 2023, we have canaloplasty in the code description. For example, if you take 66176, transluminal dilation of aqueous outflow canal, example canaloplasty with magnetic transcutaneous attachment to external speech processor within the mastoid and are resulting in removal of less than 100 square millimeter surface area of bone deep to the outer cranial cortex. So here basically only canaloplasty is included in the code description. We have few updates in the auditory system, like here revised code description 69716, 69717, 1926 and 27. So first one is implantation, second one is 17 is for replacement, and 719 is for with magnetic transcutaneous attachment, and 69726 is for removal of entire osseous integrated implant skull with percutaneous attachment to external speech processor, and 69727 is for with magnetic transcutaneous attachment to external speech processor. So in auditory system in 2023, AMA has added three codes which are 697, 28, 29 and 30, which are removal, implantation and replacement of. For example, if you take 69728, describe the removal of the osseo-integrated implant with magnetic transcutaneous attachment to an external speech processor outside of the mastoid that results in the removal of greater than or equal to 100 square millimeter surface area of bone. So 28 is for removal of implant, 29 is for implantation of implant, 30 is for replacement of the implant. I hope you got to know some updates about CPT 2023. Thanks for watching FastCoder 21. Please like, comment, share and learn from our channel.